Hello everyone, my name is Alan Chica and I am an ICU nurse working out of Durham. I recently participated in a collegiate debate regarding North Carolina's House Bill 88, the Modernizing Nurse Practice Act. After discussion and considerations of both sides of the issue, the best argument for granting advanced practice registered nurses full practice authority and allowing them to take on the roles of primary care providers is that it would increase accessibility of healthcare to underserved populations in the states. The best argument against advanced practice nurses practicing independently would be that the advanced practice nurse does not have the same qualifications as physicians to take on the roles of primary care providers. Now, advanced practice nursing organizations will counter that by referring to research showing that the value of care provided by advanced practice nurses is comparable to that of physicians. The Modernizing Nurse Practice Act is a bipartisan bill that was introduced on February 2017. The bill passed the first reading and was referred to the Committee on Health, where it was found favorable. The bill is currently sitting on the Committees of Finance and Insurance, where it is pending approval for further recommendation. If approved by committees, it will be directed back to the House for a second reading. For the most part, I support the bill, considering the positive impact the bill would have on the health of communities, the cost of healthcare, and on the roles of advanced practice nurses. Advanced practice nurses could be the solution to health gaps in underserved populations. There are 70 counties in North Carolina that are considered medical deserts for the lack of primary care availability. Nationally, only about 11% of physicians choose to work in rural areas. Lifting restrictions on advanced practice nurses and allowing them to function as primary care providers could make healthcare more accessible to rural communities. Advanced practice nurses serving as healthcare providers could also generate significant healthcare savings. Services rendered by advanced practice nurses would cost less than the same services provided by physicians. Increasing healthcare access would also increase competition and drive the cost of care down. It would generate more jobs in communities. Health economists have stated that allowing advanced practice nurses full practice authority could save North Carolina more than $43 million per year. Currently, advanced practice nurses restrictions vary between states and organizations. To many healthcare teams, the advanced practice nurses' role is ambiguous, making collaboration difficult. Allowing advanced practice nurses full practice authority would standardize their function and add clarity to their role. The preparation of advanced practice nurses would also be to higher standards by forcing the state to adopt the consensus model, which standardizes the license, requirements, accreditation, certification, and education of advanced practice nurses. More advanced practice nurses would be attracted to North Carolina to practice freely. Another effect is that more nurses would be encouraged to pursue higher educations. Personally, I feel that there should be some changes made to the bill regarding physician supervision. While I think that advanced practice nurses should be able to practice to their full authority and serve as primary care providers, there should also be some guidance by physicians considering the association of roles. Because physicians have considerably more education and clinical experience, some degree of oversight should be in place. At a minimum, there should be some kind of benchmark before the advanced practice nurses provides care autonomously. I'm afraid that the Modernizing Nurse Practice Act may fall short due to its sluggish progress. Because the bills have shelf life of 2 years, the Modernizing Nurse Practice Act is set to expire in February of 2019. In my opinion, the two main barriers to the progression are the opposing views on the practice autonomy and wording on the bill. Similar bills have failed in the past for those same reasons. If the Board of Nursing and the Board of Medicine could come to some middle ground regarding supervision, odds of approval of the bill would be greater. The bill could be presented better. The terms increased scope of practice when used to present the bill is misleading. It gives the perception that the advanced practice nurse is wanting to increase their scope of practice outside of their ability. It would probably have more success if it was coined the right to practice within their scope. There are several change requests on current policy in this bill. If the bill fails, maybe a similar bill in the future would focus on one or less changes. It could have more success. Change of practice for advanced practice nurses would be slow, but nevertheless there would be progress. Thank you for listening to my opinion on the Modernizing Nurse Practice Act.